Hey, everybody. It's us. It's May. We are back. We kind of have a hiatus. I think everybody was on spring break, all of our guests, but we are super excited to be back. I am Sarah.
And I'm Amy.
Hey, and I'm Tara. Just as a reminder before we get started, if you've got questions for our guest tonight, make sure to type them up. We're going live here on Facebook, YouTube, and Instagram. So we hope that you'll help us with our show tonight.
Okay, I'm super excited. I love when I run across people on Instagram or Facebook and their stories pop up, and Emilee's popped up. And I always feel like a slight stalker when I'm like, oh, let me look. And then I'm like, holy cow, thriving females. So, Emilee, I am going to turn it over to you because I want you to talk about your amazing life and how you're thriving with cystic fibrosis and just being an awesome person. So, welcome to the show.
Thank you. It's so nice to be here. Thanks for inviting me.
And you're in Utah, right?
Yes. Yeah. I'm in a very small town in Utah, very rural.
So. Oh, okay. So you're going to be famous after being on our little tiny show.
I'm sure. Yes.
Emilee, tell us how you've been, like, I know kind of like your biography, you said a bunch of stuff. You have a cool life. So kind of tell us how everything happened and what you've been doing with your life.
Okay. All right. So I am actually 44 years old. I was born with the genetic disease, cystic fibrosis. I have a brother that's 2 years older than me that also has it. And when he was diagnosed, my parents were told that he would live to be maybe 12. And so then when I was born, they were also told the same diagnosis. It is so it's genetic, but it is not dominant. It's I can't even think of the word. My brain is just not even working right now. But anyways, so both parents have to be carriers of this gene, recessive. It's a recessive gene. And you don't know if you're a carrier until you get a kid with it. And so, I mean, unless now there's a lot of genetic testing that can be done and things like that. But back then there wasn't a lot of hope, really. I mean, but they have come so far. I mean, like I said, I'm 44. I didn't know if I'd ever get married. I didn't know. I mean, I wasn't sure if I'd live to be old enough. I didn't know if I'd have kids. I have a daughter who is 20 and in college. I have a son who is 13. We actually, so I gave birth to my daughter, had so many complications with my health that we both almost didn't survive. But now here we are again. So my son, to get him here, I was like, I just really felt like we were supposed to have another baby. And I was like, that doesn't make sense because the first time didn't go well. And through a lot of different things, we were able to come up with gestational surrogacy and now he's 13. And so it's just such a wild story of how we got here. I've been married to my husband now. We're going to celebrate our anniversary in about 3 weeks and we'll be married for 22 years. We met in high school. So high school sweethearts, if you will.
I love
this. We dated for 5 years. Beautiful. Yeah. So it has just been quite a journey for us, a life I never thought I would live, but is just honestly more beautiful than I could hope. It's so funny for you to be like, oh, I think you're thriving, because in the ways of the world, my life is not thriving.
Which you are, because you were told younger ages, right?
Yeah. I mean, I really do just try to live every day like I don't know how long I'm going to be here, but I'm grateful for every day that I get. So,
Emilee, so people tell us about cystic fibrosis. Like, how does it affect you, and when did you start seeing the effects of it?
Yeah. So when I was born, I actually had to have surgery at just a few days old because I had a blockage in my intestine. Some people, I'm not exactly sure what it's called. For a lot of cystic fibrosis babies, they do have this issue called meconium ileus. But my mom was told by the doctors that was not what I had. So they had to take out part of my small intestine. I have a big scar on my stomach. At just a few days old, they didn't know if I was going to survive the surgery then. So it really has been this life of like, oh, how much longer is she going to have? I've had a lot of incidences where my health was not good. But probably, I mean, I always had to take pills. My brother and I always did nebulized treatments. And when I was younger, we really didn't do medicine. We were just nebulizing sterile water. That's all it was, which is so weird to me to think about. But it was, so you get a lot of mucus built up in your lungs, which breeds bacteria, which then causes lung damage, infections. The first time I actually went in the hospital, I was 15 years old. And honestly, I felt like, okay, this is the beginning of the end. My brother had never been in the hospital. I didn't know people. Again, I live in a small area. I didn't grow up with people with CF around me. Growing up, we didn't know we couldn't. So there were like CF camps, things like that, where people with cystic fibrosis would go and just, you know, enjoy time together and hang out. Well, we didn't know at the time, because science hadn't come that far, that that was actually not a good thing. We're actually not supposed. I don't know if you've ever seen the movie 5 Feet Apart. Did you ever see that? Okay. So it's a movie that is about cystic fibrosis loosely. I'll just say that. Like it's a fine show for someone who doesn't know anything. But if you're a patient watching it, you're like, that's not right. Like you sit and see all the things that they maybe got a little bit wrong. But the whole premise is you're supposed to be 6 feet apart from each other. And so that's really tricky when you have a sibling. But again, we didn't know until we were probably into our mid-teens, early adults age, that we were actually like spreading bacteria to each other that can cause more lung damage. So fortunately, my brother and I always carried the same bacteria, so we didn't ever feel it was a problem until 2020, when he got diagnosed with a different bacteria that was pretty harsh and would cause me, because I'm at a lower lung function, a lot of problems. And so we've had to be really, really careful in how we connect and how we, you know, are together at family things. We both wear masks. Honestly, it's almost like 2020 COVID. That's kind of how we have to live our life together, you know? And so that's been a challenge because we're super close. But you know, you just figure it out.
Yeah.
So
Now, does your children have the genetic? Now, is it passed down? Is that how it works?
yes, so they both have one genetic copy of one of my mutations. So I have 2 mutations, and they've both been tested when they were born to see if they had it. My husband was actually tested prior to doing the gestational surrogacy, and we found in this test that we did, there's multiple mutations, and so we did like this 1,500 that it would test for, and he didn't have any of those. So we felt it was safe to just pick an embryo and not pick one based on genetics, if that makes sense. So fortunately, neither of my kids have CF. They both have the mutation, and we'll have to think about, you know, genetic testing when they get married, because their kid, if they marry someone that has the mutation, they most likely will have children with it.
How popular is it?
So 30% of all Caucasians are carriers. I don't know sorry, I think it's 30% of all Americans, maybe. I don't know. I know there's a lot of different studies for different ethnicities, but Caucasian is the most prevalent. So you could be a carrier and have no idea. My parents had no idea. They had never heard of the disease before.
So Emilee, what is the path for ensuring that you stay healthy in terms of what type of focus doctor, how often do you go to be checked, and or blood test or other, you know, markers or analyzers to determine, you know that you're still strong and you're doing well? What does that look like?
Yeah. So we do, I do nebulized treatments 3 times a day, sometimes 4 if I'm not feeling well. And that just involves like 4 different medications throughout the day. There's like different times of day that I do it. It helps bring up the mucus to get out so it's not breeding infection. I always have bacteria that I'm growing, and it can start to like get out of control, and then I end up in the hospital. How they know like how I'm doing, a lot of times for me, I can tell I'm just a lot more tired, I'm coughing more. They do, it's called a spirometry test, where they do a PFT, and then they check your FEV1, so how much forced air gets out in the first second, and that kind of determines where you're at. So I in 2018 I got influenza and was really, really sick. Like, it was a little bit scary. We weren't sure if I was gonna come back from that or how. And it took my lung function down quite a bit. I was going in the hospital more frequently, like 5-6 times a year, and a hospital stay. So they do a PICC line, which is a line instead of an IV that goes from your arm all the way up to your heart. And they just dump in really strong antibiotics to help kill and push down the bacteria that's kind of out of control. And then after I had influenza, I was going in like 6 times a year, where before I was going in like 2-3 times a year. And it's at least a 2-week stay for me. Some people it's 10 days, but because of, different things with my health, I usually stay the full 2 weeks. Anyways, throughout 2019, I was having a lot more issues and really felt like a lung transplant was going to be in the near future. So I went to Stanford Hospital in California and did a lung transplant workup, which was really crazy, like super in depth. They are checking every bit of your body to see if your body can handle that type of surgery and recovery. And the last day of our week there doing all the testing, my doctor called and said, the drug that they've been studying is going to be available. It will probably take about 2 to 3 months to get you on this drug, but I just wanted you to know that might be an option before transplant. So then I had this really big decision to make, like,
oh my goodness,
what am I supposed to do? Because this feels huge. Like, and the doctor there was really candid and was like, you could be 1 hospital stay away from not being able to get a transplant. And I was like, okay, I don't, so anyways, I'm a very faithful, spiritual, religious, prayerful person. And that took a lot of prayer and a lot of faith to be like, what's next? Like, what am I supposed to do? Because this feels like life or death, and I really felt like I should wait. I was 40 at the time, and I was like, you know what? I've waited 40 years for this. I can wait 3 more months. And I did. And so then this drug, Trikafta, came out, and I started taking it. And within hours, I could feel a change. I remember taking
You're giving me chills right now. Really? Yeah. I mean, holy goodness.
Yeah. So I took a deep breath for the first time in years, and I was like, oh my gosh, this is wild.
Is it a pill or was it like a
it's a pill. Yeah. So it's a pill you take in the morning, 2 pills in the morning and 1 at night. And I was doing amazing. After 10 days, I was like, I feel like a different woman. I used to be on the couch a lot. And I was up all the time. My kids were like, I don't know really what to do with you because we're not used to.
You need to reintroduce yourself.
Yes. Yeah. And
hi, I'm Emilee.
Yeah.
Right. That would
you
be
don't
mom.
know me, but I've been here before. Anyways, but on day 11, I broke out in a severe rash. Hives, like the craziest hives you've ever seen, all over my body, except for my face, which I was really grateful. But it was so itchy, so painful. And my doctor was like, I was like, I'm going to push through this. And then day 12, it just went completely out of control. And my doctor called and he's like, it's time, you got to go off it. And I just felt so shattered. I was like, I don't know how to go off this. Like, that feels like there's no hope, you know?
Yeah.
And he made me a promise that he and the pharmacist were going to work really hard to get me back on it. And they did. And so that was in November. In January, the beginning of January, they were able to get me back on it with a lot of steroids and a lot of prayers. And I finally, I mean, here I am 4 years later and still thriving. So
thriving. I told you, Emilee, you are.
Right?
Did they have to change the dosage of
No,
it?
I mean,
Exactly what
so
I was thinking, Tara. Yeah.
what they did was, it's called a desensitization, where they just give you a little bit every hour to kind of help your body like build up to it,
So
which
like
I'm
a
allergic to.
Like
No,
a drip?
it was still
No.
a pill.
Still
But
a pill? Okay.
with an antibiotic that I do IV, I've had to do it that way, where it is a drip.
Oh,
They just do
okay.
a little bit.
Okay.
So
Your body was having like a 12-day party, and then it needed.
Oh yeah, and it's like, wow.
You're like, this is a marathon, not a sprint.
Yeah, exactly, exactly.
Emilee,
Yeah,
now is
so-
this pill that you're on, is that like fighting the constant infections that you're getting? Is that what it's doing?
It's actually working at the cellular level. Like, it's not just a blanket treatment as everything else has been for cystic fibrosis. It's actually changing our genetics, which is really crazy. It has actually changed medicine in a lot of ways, and the way that they're looking at treating different illnesses, not just cystic fibrosis. It's not a cure. A lot of people,
cure or slows
yeah,
it down?
no, a lot of people get confused and they're like, oh, it's a cure. We don't need to raise money for cystic fibrosis. They're done. But it's actually not a cure. And I mean, as you can see, I'm still on oxygen. Like, there's been a lot of damage to my lungs, over 40 years of damage. And so I definitely have a better life than I did, but it's not like where I had hoped it was going to take me. Everybody responds so differently. So many people have gotten their lung function back and better than before. And they really are doing amazing. I still go in the hospital 2 to 3 times a year. I still have all the things I was dealing with before, just not quite at that scary level where, like, oh, anything could take you at any minute, you know? And so that's been a little bit of a breath of fresh air.
Emilee, did your brother do the drug as well?
Sorry, what was that?
Did your brother do the drug as well?
So interestingly enough, he was in the study when it started, and he got a rash. And so he didn't take it for a while, and his lung function is significantly higher than mine. Which is so interesting how genetics work. But he just this past, I think it was in April, started. So he had tried again maybe 2 summers ago, broke out in the exact same hives I had day 11, which is so weird.
There's a limit on the party. It's 12.
Yeah, exactly. But then my doctors were able to get him back on it this past.
Does he have the same experience?
He's still on a lot of steroids.
Does he feel like amazing like you do?
Yes. Like we used to cough all the time. Like, I couldn't have done this interview without coughing. I might still cough. It could happen, but like a lot of coughing. So you're physically exhausted all the time because your body is trying to breathe. It's trying to cough. It's, you know, and even still, I get tired a lot. If I go to sea level, shockingly, I don't need oxygen. I have so much more in my body.
Emilee, hang on. Don't say any more good stuff. Your phone's like, turn your phone a little. It's cutting out.
Oh no. There we go.
I think we can see you again.
Okay, can
Yes,
you hear me
you're
now?
back.
Can you hear me?
Yes. Yes.
Okay.
Back. Good.
I turned
Okay.
off my Wi-Fi because it was not connecting well, so that might be part of the issue.
No,
but what
Now,
did
Emilee,
what
have you
cut out?
ever been able to work? Have you been able to work before? Like, or is
So
that just too tired?
I did. I was really a go-getter. I was like one of those people that like, I'm gonna change the world. I wanted to just be like, I don't know. Anyway, so I went to school. I got a bachelor's degree in psychology.
Oh.
I wanted to go on and get a master's, and just for whatever reason didn't feel that was right. That was right when my husband and I got married. And I started working. I worked for a company where we placed people with disabilities in like a foster care. And then we would kind of help oversee their care, make sure that they're like financially they were being taken care of, that their foster family was doing all they were required to do, and, you know, treating them well, all that type of stuff. And I loved it. It was such a rewarding, incredible job. And I'm still friends with my coworkers that I had 20 years ago. But my health really just suffered. I went in the hospital so much. And that was when my doctor was like, I don't feel like stress is very good for you. And this is a really stressful job. And so I ended up, well, that's also right when I found out I was pregnant. And I realized that I would have to make a sacrifice if I was going to actually have a healthy baby. And so I ended up quitting my job. I actually got on disability, and we moved home, which is where I live now. Not home, but home to Fairview, where I live now. And I never wanted to do that. I was like, I am leaving this place. I'm never coming back. Like, see ya. And now we've been here for over 20 years, and it's been really good. It's not what I chose, but it's been better than I could have chosen for myself. So,
Emilee, do you have to be very careful when you're out in public with germs and stuff?
yes. Yeah, that has been always an issue, especially in the winter. I'll just say that the pandemic was awful. It was one of the hardest times of our whole family's life. You know, my kids couldn't go to school. My husband worked from home. We were literally just like in this house and not this house, we sold our house, but just stuck in this house together for a year. And it's like, I don't know if we're all going to come out of this okay.
But did they all stay home because they couldn't get anything because of your health, right?
Yeah, we were just worried about them getting COVID and then bringing it home to me. So we didn't see people. I mean, we were like those crazy strict because we had to be.
Yeah.
You know, but funny enough, I mean, we went to New York when my daughter graduated 2 years ago. And I know that, like, I'm not promoting anything, nation, whatever, but I did get vaccinated. And we went to New York. I started feeling a little off, but I just thought it was like allergies from being in this new place. The air is a little crazy there. And I didn't feel terrible. Also walking a ton because I'm not really used to that. And I mean, just miles and miles a day, you know how it is there. And anyways, I was just really tired, but I didn't feel terrible, which anyway, I get home and my husband starts feeling sick. He tests for COVID, and I realized I've had COVID for 5 days and didn't know it. So it was really
thriving.
Yeah,
that's right.
Yeah. Anyway,
you crushed it. You blew it right out of the water, right? Yeah.
Yes. Yeah.
So
and
talk
I've
to
actually
us.
gotten it since then, and also did really well. So
Yeah. So the other thing that you like to do is
Disneyland. Yes. That's my husband. And my husband is in a wheelchair actually, because he had a bum knee. He had to get his knee, his ACL blew out, and he had to get that surgery, but he hadn't had surgery yet, and it was really hard for him to walk. So he and I actually shared a wheelchair, or a mobilized wheelchair, which was hilarious. Like, he would ride it on the downhills and I would ride it on the uphills. And that just says a lot about how we are as a couple, because we really do just take care of each other.
But you guys go to Disneyland a lot?
We do. Yes. We're actually going again in August. So we try to go once a year.
Well, Tara's
That's
a
your
big
safe
Disney World
haven
person.
then, huh?
Yes.
Sorry.
Yes.
Yes.
Yeah.
Love it.
So,
Oh,
what did you say about Tara?
Tara is a huge Disney person.
Oh, my daughter wants to go to Disney World so badly. I'm like, we need to make it happen. But we haven't.
Yeah.
she went when she was like 3, but she doesn't remember it at
Yeah, but it's great to show because like you're sharing like, yes, COVID during that year, you had to make a decision for your family, but then you've also chosen to do other adventures like New York and continuing to go to Disney.
Yeah,
and stuff like that.
I had to come to the realization that like life is gonna happen, whether I'm involved in it or not, and I'm here living, like let's live. I can't just hide in a bubble all the time. And so that is the choice I made. And you know, everybody's choices are going to be different, and I commend them for whatever they choose because it's hard. You know.
And so I was going to ask you the question, what would you tell our viewers in terms of some of the challenges that you've been through and some of the things that you have embraced to really move the dial and live and with New York and Disney? Anything else that you want to add to that really has made a difference to say, I'm doing this, I'm living. Yes, I have challenges, but I'm breaking through the glass ceiling, if you will. Yeah.
I mean, first of all, I think exercise is huge. I'm a big advocate for keeping our body as healthy as we can. I'm not always great at it, but it is something that I really do try to do because I know that like you don't use it, you lose it, you know? And for me, that's just been a really big part of my health journey. And I know it's actually saved my life. As for like, I mean, anyone with chronic illness, you just have to make tough choices every day. You know, when I was really sick, it was like, oh, I choose to go to this show with my husband, but then I might be on the couch for a day. Like, you really just have to pick and choose what is important to you. With my kids, it was my kids. I'm like, I'm not missing out on their life. Like, I'm going to do everything I can to be a part of it. And there might be a time where I make a choice that actually affects my health in a really negative way. And I'm going to have to live with that. But I will know that I have lived my life as best I can. You know, we go to the beach every summer. We just really try to make these memories because those are the things they're going to remember. I mean, just really quick, I know we're almost out of time, but when I was in that place of near transplant, I realized I was really pulling away from my family. I was just constantly watching Netflix. That was like my drug of choice, if you will. And I had headphones in all the time. I just wasn't connecting with anyone. And then I realized, like, is that how I want them to remember me? And for me, I was like, oh, I'm protecting them because if something happens to me, then they're not going to feel as bad. Of course, they're going to feel bad. They're going to feel bad whether I'm involved in their life or not, and they'll probably feel worse if I'm not. You know? And tried to make that commitment to really be more present in all of my relationships. Like, just make sure that the people around you know how you feel about them. And that is how I really do try to live that way and try to just be this like positive person in people's lives because everybody needs positivity. And living that way has actually helped me to be a more positive person, you know?
Well, amen to that.
Emilee, you're like thriving in like so many ways. Like, what?
Right? You're so inspiring. You really are.
Thank you.
And thank you.
That's really nice.
And you gave us like such have educated me on cystic fibrosis. I really did not know all the details about it and how it affects people. So this was very enlightening. And I love how you are thriving in life. And you had a great message for anybody out there, chronic disease or not.
Thank you.
Yes.
Thank you. I want to just say one thing. When I was born, like this was a childhood disease that most didn't see adulthood, right? And now if you look up cystic fibrosis, it will say they are expected to live a long, thriving life into adulthood, which is pretty remarkable for any illness, you know, any disease.
That just tells you how far medicine has come.
Yeah.
That's right.
Yeah.
Case in point, right? Yeah.
Well, I love it. We are going to continue to follow you, Emilee, on your Instagram, and we hope nothing but good things for you. And this drug, your party drug, keeps going on and on.
Thank you. I'm going to call it that from now on. My party drug. It might.
See, there you go. That's your stamp of approval.
Hopefully, I don't end up in jail.
I swear this is real.
It's a trial drug.
Yeah.
You can blame it on the thriving females. They called it
Yeah,
a party
I will.
drug.
That's right.
I will.
That's right.
Oh, well, Emilee, thank you
Thank
so
you.
much for chatting with us. I really
Oh,
appreciate
thank
it.
you.
For our viewers, I know we've got another guest already lined up for May 23rd. Amy, do you want to give a little teaser on who will be joining us?
We do. So this is a gal that I have known really most of my life, and she is aggressive. She is assertive. She is a business gal, and decided to get super creative in the fashion realm, and decided to kind of do her own thing. And so Leisha is her name, and I won't give any more details, but
All we
she's
get.
just like you, Emilee, truly a bright light, and wants to share with other folks that, you know, when you have something that you really want to go after, sometimes you just need to buckle up and see it through. And that's what she's done. And she's got some exciting things to share with us. So yeah,
Awesome.
and more to come. We've got some more folks that we're in connection with now. So we'll have additional pivotal guests coming along. So thanks for joining, gang.
All right,
Thank you, guys. It was so good to
bye.
be
Thank you
here.
so much, Emilee. Bye.
Thank you. Bye.